One rule is the woman's eyebrow is a lot thinner than the men, so the diameter of the woman's right here. So for men it's a little bit thicker, and you estimate it, it's around half a centimeter or even 3/4 centimeter. For men you can go as a little bit, but this is a little bit shorter, so thinner. So number one. Number two, where does the eyebrows begin? So if we draw the imaginary line on the lateral side of the nose and go through the part up to pass through the medial side of the eye, that's where the eyebrows begin. Now where does the eyebrow end? So how we do it, so we put another, again, imaginary line, or we use any object straight. So on the lateral side of the nose, go pass through on the lateral outermost of the eye and where it ends. So this is how I find out where her eyebrows is. And the height of the eyebrow, which is the arch, it can vary from one patient to another. It just depends on their preference. However, the typical one is you have the you put any straight line on the lateral side of the eye, nose, and go straight through the pupil. And up there, that's where the height is. However, this patient preference, she want her height, the arch is the apex of the arch on the more lateral side, and that's not wrong, but that's the preference. Some women have one in the middle, someone want the arch and on the shape. So that's we leave the apex of the arch to the patient. However, the medial and the lateral side, that's my recommendation. Even this said, it's a rule. I don't force upon a patient. That's my only recommendation. But that's tend to shape the face and make the face look a lot more, bring out the features sharper. Now, so that's, we talk about the shape. Now we talk about the depth, how thick the eyebrows and how long it is and the arch. Now the next step of the eyebrow restoration is what? The hair. So on the medial side of the eyebrows, the hair is all, well, number one, all the hairs are single hair strand. And the other number two is the angle gotta be flat against the face. And so on the medial side of the eyebrow, all the hair will point upward, will grow upward and flat against the face. And as you go outward on both sides, more lateral side, the upper half of the eyebrow, the hair tend to point down and out, down and out. And on the bottom half of the eyebrow, the hair will point up and out, up and out. So it's fused together like a fusiform, and merge together and make it like real shape the eyebrow. And when we reach the height and the turn, again, it's still down and out, up and out, lateral, and then we'll continue when we turn the shape. So eyebrow restoration is very, very difficult. It requires a lot of attention to detail. It requires a lot of work, and require a lot of planning, and it can be achieved to a very good look. And what you expect after eyebrows, once we transplant the eyebrows will grow right away. By the second week to 2 months, the eyebrows will fall off, but the roots go to sleep. And by the 4th month, the hair will grow, and 8 months you have a nice head of hair. The uniqueness, because of the hair from the back that we take out and transplant in, so those hair have longer anagen cycle. That means they tend to grow faster and longer. So you had to trim it. So that's the only difference. The caliber is a little bit larger, but people will not notice. Eyebrow restoration can be very natural. No one have to know, and you don't have to tell people, and it still look very sharp and really frame the face. So that's what the gist of the eyebrow transplant, and that's why there's not many specialists who specialize in eyebrow restoration, except in Northern California. I'm the main one. And this is the eyebrow restoration and eyebrow transplant on female. Thank you.